Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about the visual contrast sensitivity test. Just before I jump into the content here, just in case you're watching this video on YouTube, please note I don't receive any compensation from YouTube for any ads that they might run before my videos, and they don't ask me for approval for any types of videos that or any types of ads that they run before my videos. So with that out of the way, this is a test that has been around for, to my understanding, around 30 years or so, give or take, and its main purpose is to identify whether a person is suffering from neuroinflammation or not for some reason. So how does that relate to mold? Well, if a person has mold toxicity or mold illness, then that will very likely cause neuroinflammation, so brain inflammation. It'll cause inflammation in other body parts as well, but one of the areas that it will typically inflame is the brain. And so therefore, if a person has if a patient has mold toxicity or mold illness and they do this visual contrast sensitivity test, then there's a very high chance that they're going to fail the test. To my understanding, there's about a 90% fail rate if a person has mold toxicity. So one of the great advantages of this test is that it's quite inexpensive. It's about $20 to do the test. It takes about 15 minutes to do the test. You just do it at home, and the results we get the results back instantly. So the big advantages of the test is that it's cheap, it's quick, and just very convenient. Now, the big disadvantages of this test are that it's not specific to mold. So again, to my understanding, the purpose of this test is to identify whether there is neuroinflammation going on, and unfortunately, a number of things can cause neuroinflammation in addition to mold. So persistent infections with the Lyme disease causing bacteria can do that. Other co-infections like Bartonellosis, babesiosis, mycoplasmosis, etc. can do that. Different chronic viral infections can do that. Heavy metals can potentially do that. Other toxic substances that a person might be exposed to, like certain chemicals or whatnot, can potentially do that. So there are a number of different things that can cause, other causes of mast cell activation syndrome besides mold can also cause that too. So there's a lot of things that can cause neuroinflammation. So it's a useful test to track inflammation in the brain, but it doesn't distinguish or differentiate what the cause of it might be. However, with all of that being said, depending on the case and the circumstances and all of that, and these are all things, of course, you'd have to discuss with your own healthcare provider to make heads or tails of how this test might apply to you or your case, but depending on the circumstances, in my opinion, the VCS test, the visual contrast sensitivity test, can actually be a very useful test, and it can actually be quite a bit more specific for mold in certain patients than it might be for others. So for example, if I have a patient and I've thoroughly treated them for Lyme, co-infections, viruses, etc., we've done heavy metal detoxification, they're not being exposed to any chemicals that we're aware of, we've mopped up their diet and this and that, so I don't think that there's a big unaddressed histamine component to things happening. If they do that visual contrast sensitivity test, then and they fail the test, well, there's not that many other things, to my knowledge, that could cause them to fail that test. And so in that case, I have a conversation with the patient saying, well, we could do a urine mycotoxin test to see if there's a mold issue, but this is a fraction of the price. It's so much faster, and maybe let's do this instead, or do both, whatever the patient wants to do. But in a case like that, in my opinion, I feel that the test can actually be quite specific for mold in that particular case, depending on the patient's history and symptoms and all of that. Whether or not we're using the test as more of a I guess, for lack of a better way of putting it, like sort of a diagnostic aid in lieu of doing more specific testing for something like mold, we can use the VCS test, or at least in my patient practice, I can use the VCS test to track how a patient's doing as well. So if I have a patient and they've, whether or not I'm definitively, whether or not I am 100% convinced that them failing the VCS test is definitely related to mold or not, if they say, we know that there's a mold issue, or we're highly suspected, they do the VCS test, they fail the test, and then they're undergoing treatment for mold, so using their nasal spray, they're doing their detox support, their binders, all that good stuff, they're feeling better, then they could do the VCS test again. And if we see it getting better as they're getting better, then that starts to look like, maybe we can actually use this test to track their progress. And then maybe a couple of months later, hey, do the VCS test again. Oh, you're doing even better on it. You're failing the test by even less. And eventually, it's always very exciting when patients finally pass their VCS test, because then we have a fairly high level of confidence that they've hopefully dealt with the mold or whatever it is that's causing the neuroinflammation. So I will leave this video here. With the VCS test, you can look it up on YouTube or some other site, or kind of look it up in terms of an explanation for what it is. If anybody wants me to post a video explaining what it is, I'm happy to do that, but I've already got over the 5-minute mark, which is verboten in social media terms, so I had best leave it here. But I hope that this information is useful, and if anybody has any questions about this topic or anything else, just post them in the comment section below, and I'll do the best that I can to answer that question.